Now this is anatomy question paper 1 part 2 of MBBS 2020 batch, the supply batch of ABVMU, Atal Bihari Vajpayee Medical University of Uttar Pradesh. This exam was conducted on Monday 23rd of May 2022. This paper again is of 50 marks. Here again there are 3 questions. Question number 1 is a clinically oriented long question of 20 marks. 4 short questions of 5 marks each, that again makes it 20 marks, and 10 MCQs of 1 each, that makes 10 marks. So this is how it was the question paper in 2020 batch. Although the exam was conducted very late, that it's 23rd of May 2022. So let's begin solving this question paper. Pehla question you can see here is question number 1. A 50-year-old woman came to the surgeon with the complaints of hard, painless lump in the outer upper quadrant of her right breast. On examination, the axillary lymph nodes were found to be enlarged. The biopsy of the lump revealed that it is a case of breast carcinoma. Please answer the following questions. अब देखो यहाँ पे कितना फ़ायदा होता है प्रीवियस ईयर्स क्वेश्चन पेपर्स को रिवाइज करने से। ये क्वेश्चन रिपीटेड क्वेश्चन है, बहुत ज़्यादा पुराना भी नहीं, इसी बैच के मेन एग्जाम का क्वेश्चन है ये, विच आई हैव ऑलरेडी सॉल्व्ड। जो MBBS 2020 का मेन एग्जाम का क्वेश्चन पेपर मैंने सॉल्व किया है, पेपर 1 पार्ट 2। एक्चुअली उस वीडियो में पेपर 1 पार्ट 1 पार्ट 2 एक साथ है, सो यू कैन वॉच इट। वहाँ मैंने इसको काफ़ी डिटेल में एक्सप्लेन किया है। सेम क्वेश्चन इज रिपीटेड इन द सप्ली बैच। तो इसके सब पार्ट्स में क्या क्या है? डिस्क्राइब द एक्सटेंट ऑफ द ब्रेस्ट, यू नो इट, वर्टिकल 2 to 6th rib, and transverse is from parasternal, remember, not from the mid-sternal but from parasternal or the lateral border of the sternum up to the mid-axillary line. Enumerate the muscles forming the bed of the mammary gland. Of course, major portion, around 70% of the breast overlies pectoralis major, and laterally it extends onto the serratus anterior muscle, although a little portion of its inferiorly also rests over the external oblique muscle of abdomen. And you can also express that some portion of it also will be lying over the rectus sheath, because the upper limit of the rectus sheath reaches up till the 5th rib, and breast in vertical extent reaches from 2 to 6 ribs. Then describe the blood supply of the breast. That also is easy. The branches from the axillary artery, superior thoracic artery, the pectoral branch of acromiothoracic artery, the lateral thoracic artery, the anterior intercostal arteries mainly 2 to 6, and the lateral branches from the 2 to 6 posterior intercostal arteries. They will supply the breast, and same will be the venous drainage. Describe the lymphatic drainage of the breast. This is super important question. I believe every student prepares this before going for the exam. So lymphatic drainage of the breast, you can divide into 4 quadrants. Remember, the upper outer quadrant mainly drains into the anterior group of axillary lymph nodes. That's also called pectoral group of lymph nodes, or you can say the superficial lymphatics from the breast that drains into the anterior group of axillary lymph nodes, and that also includes the subareolar plexus of Sappi. However, the medial portion of the breast also has communications. The lymphatics have communications with the opposite breast, and that's why we say that the carcinoma from one breast can reach to the opposite breast as well. Remember, the deeper lymphatics from the breast, they pierce the clavipectoral fascia. Firstly, they pierce the pectoral's major muscle, then the clavipectoral fascia, and then they drain directly into the apical group of axillary lymph nodes. They also drain via the lymphatics which come out through the intercostal spaces to drain into the subdiaphragmatic group of lymph nodes. So that's how the carcinoma might reach down to form secondaries into the abdominal organs, maybe liver and maybe ovary. That's called Krukenberg's tumor. Remember, it might also reach into the spine, that is the vertebral canal, that is through the venous route to the internal vertebral venous plexus. So you can describe that, but remember, there are intermediate group of lymph nodes also. From anterior, the efferents will reach to the central group, from central to the apical, then from apical to supraclavicular group of lymph nodes. Then write the applied anatomy of the breast. So in case of applied anatomy, remember when they write applied, you also have to include clinical anatomy, because they might have in their mind but they have not written it properly. It actually is always asked as clinical and applied anatomy of the breast. So you can include the clinical signs and symptoms related to the carcinoma breast. Pudgy orange is due to blockage of the superficial lymphatics. Dimpling on the surface of the breast is due to the impingement of the carcinoma to the suspensory ligament of Cooper's. Then puckering of the breast is due to involvement of more than 2, 3, 4 ligaments. That's the suspensory ligament. If there are more than one involved, then it causes retraction of the surface of the breast. Then retraction of the nipple is due to involvement of the lenticephorous ducts behind the nipples. And remember, palpation of breast for the screening of carcinoma breast is even taught to the common people as a part of your community medicine postings. Then even the art of breastfeeding has to be taught to the layman people as a part of your community medicine posting. Then importance of fibroadenomas, those are the breast mouses. Then the importance of about the cosmetic surgeries, breast augmentation surgeries, breast reconstruction surgeries, especially in case of gynecomastia. So you can include all those things here. But let me tell you again that this is not a clinically oriented question. Even if they have not written the paragraph above, then your answers to these questions would remain the same. So I think this is not a properly framed clinically oriented question, because they shouldn't have mentioned the diagnosis. It should be as a part of question to describe the diagnosis. Now question number 2 is about write short notes on. So here question number 2A is circle of Willis. This is a super important question from the neuroanatomy unit, and I believe every student prepares for this question before going for the exam. And still I would insist, if you're about to go for your exam, do read this question from the book. And to help you, I can just provide an image here. So this is the image you can draw. इसमें दिख रहा है कि एक सर्कल है बीच में, राइट? दिस इज द सर्कल ऑफ विलिस. अब ये क्या होता है, कहाँ होता है? सीधी सी बात ये है कि दो एंटीरियरली प्लेस्ड इंटरनल कैरोटिड आर्टरीज और दो पोस्टीरियरली प्लेस्ड वर्टिब्रल आर्टरीज के बीच में एंटेरो पोस्टीरियर एनास्टोमोसिस होता है और साथ साथ बाइलेटरल एनास्टोमोसिस होता है. ठीक. एंड ये जो सर्कल ऑफ विलिस है ये पाया कहाँ जाता है? इन द इंटरपेडेंकुलर सिस्टर्न रेस्टिंग ओवर टू द डायफ्राग्मस सेलेई. इसके बीच में से पिट्यूटरी ग्लैंड सस्पेंडेड होता है हाइपोफाइसिस सेरिब्राई से. ओके. अब इसमें तुम सीधे से बना देना कि दो वर्टिब्रल आर्टरीज होती हैं जो कि फोरामेन ऑफ मैग्नम से इंटर करती हैं. दो इंटरनल कैरोटिड आर्टरीज होती हैं जो कि कैरोटिड कैनाल से इंटर करती हैं. फिर जब ये इंटरनल कैरोटिड आर्टरी अंदर पहुंचती हैं तो ये अंदर जा कर के पहले पेट्रस कोर्स लेती है, देन कैवर्नस साइनस में कोर्स करती है, देन इट कम्स इनटू द मिडिल क्रेनियल फोसा और वहाँ पे इट गिव्स आउट इट्स इंट्राक्रेनियल ब्रांचेस जो कि तुम्हें दिख रहा है. एंटीरियर सेरेब्रल आर्टरी देगी ब्रांचेस, ऑफ्थैल्मिक आर्टरी ब्रांचेस देगी, एंटीरियर कोरोइडल ब्रांचेस देगी, पोस्टीरियर कम्युनिकेटिंग आर्टरी ब्रांचेस देगी, एंड लास्ट ऑफ ऑल middle cerebral artery, which actually is the continuation of internal carotid artery. ठीक. अब एंटीरियर सेरेब्रल आर्टरी आपस में कम्युनिकेट करती हैं बाइलेटरली क्रॉसिंग द मिड लाइन एंड दैट इज कॉल्ड एंटीरियर कम्युनिकेटिंग आर्टरी. और एंटीरियर कम्युनिकेटिंग आर्टरी की एक ब्रांच होती है आर्टरी ऑफ ह्यूबनर. ये सेंट्रल ब्रांच होती है, सेंट्रल परफोरेटिंग ब्रांचेस. Similarly, middle cerebral artery की lenticulostriate branches होती हैं which they have not shown, that is called Charcot's artery, which is the commonest artery for cerebral hemorrhage. और cerebral hemorrhage होता क्यों है? Obviously hypertension की वजह से होता है, बट इसमें बेरीज एन्यूरिज्म्स होते हैं. तो बेरीज एन्यूरिज्म स्मॉल लिटिल आउट पाउचिंग्स होती हैं आर्टरियल वॉल से, सेंट्रल ब्रांचेस से, तो इसकी वजह से cerebral hemorrhage कॉमन होता है. रिमेंबर, Charcot's artery is also called the artery of cerebral hemorrhage. That is actually the lenticulostriate branches from the middle cerebral artery. तो यहाँ पे तुम्हें ये दिख रहा है एंट्रोमीडियल सेंट्रल ब्रांचेस भी दिख रही हैं एंटीरियर कम्युनिकेटिंग आर्टरीज की. अब पीछे से दिखलाना है. पीछे से ये है कि फोरामेन मैग्नम से दोनों वर्टिब्रल आर्टरीज इंटर करती हैं, दोनों की स्पाइनल ब्रांचेस निकलती हैं, देन दे फॉर्म एन अनपेयर्ड आर्टरी दैट इज कॉल्ड एंटीरियर स्पाइनल आर्टरी, which descends down into the anterior longitudinal fissure of the spinal cord. Then it also gives posterior inferior cerebellar artery, which is having a tortuous course. Then it gives its branch called anterior inferior cerebellar artery, and from that you can see there is also a labyrinthine branch और an auditory और internal auditory artery कहते हैं इसको. Actually the two vertebral arteries, first of all they form a basilar artery, and from the basilar artery you can see anterior inferior cerebellar artery has been given out. और कुछ बुक्स में ये labyrinthine artery direct branch होती है from basilar artery. Then it gives out several pontine arteries and it also gives a superior cerebellar artery. अब cerebellar arteries तीन हो गई, superior cerebellar, anterior inferior cerebellar and posterior inferior cerebellar. इसमें पूछा गया है which is the dominant blood supply of cerebellum, तो आंसर होगा superior cerebellar artery. Out of the three minimum supply cerebellum की कौन करता है? Anterior inferior cerebellar artery. Okay, after giving out these branches, basilar artery when reaches at the level of this junction between midbrain and pons, there it gives out its terminal branches called the posterior cerebral arteries, both the sides. These posterior cerebral arteries also give their central branches called posteromedial central arteries. Then you can see that these posterior cerebral arteries are communicating with the posterior communicating artery of the internal carotid artery, and that's how a circle is completed. So remember, the circle is completed by two communicating arteries, anterior communicating, which is an unpaired, and it is communicating between the two anterior cerebral arteries, and posterior communicating artery communicates between the internal carotid and the posterior cerebral arteries. So this is how you can draw the diagram and explain the different branches, and the purpose is to maintain a bilateral circulation of equal blood pressure as well as to maintain an equal pressure anteroposteriorly in the brain as well. ठीक है, और एक बार इसकी रीडिंग ज़रूर लगा लेना बुक में से. नेक्स्ट क्वेश्चन 2B, CSF सर्कुलेशन. अब इसके बारे में बहुत अच्छे से बहुत डिटेल में एक्सप्लेन्ड एक वीडियो है मेरा, वो मैं अटैच कर रहा हूँ लिंक इसमें, तुम उसको देख लेना ज़रूर से, बिकॉज CSF सर्कुलेशन में डिटेल में लिखने को आ जाता है और इसके ऊपर रेलेवेंट MCQs भी बनते रहते हैं. सो वॉच दैट वीडियो, आई विल अटैच द लिंक. नेक्स्ट क्वेश्चन 2C इज अबाउट मूवमेंट्स ऑफ शोल्डर जॉइंट. तो इसमें सबसे पहले तो ये अच्छे से लिख देना है कि शोल्डर जॉइंट इज द मोस्ट मोबाइल जॉइंट हैविंग द मैक्सिमम फ्रीडम ऑफ मूवमेंट इन द ह्यूमन बॉडी. ठीक, तो इसमें मूवमेंट हर प्लेन में हर एक्सिस में होता है. जैसे एंटेरो पोस्टीरियर प्लेन की अगर बात करें तो इसमें होता है फ्लेक्शन एंड एक्सटेंशन, एंड दैट हैपेंस अक्रॉस अ ट्रांसवर्स एक्सिस. तो अब इसमें जो मूवमेंट्स लिखोगे उसके साथ मसल कॉजिंग दोज मूवमेंट्स भी लिखने पड़ेंगे. तो फ्लेक्शन में क्या क्या लिख दोगे? एंटीरियर फाइबर्स ऑफ द डेल्टॉइड लिखोगे, क्लेविकुलर फाइबर्स ऑफ द पेक्टोरलिस मेजर लिख दोगे, देन कोरैकोब्रेकियालिस लिख दोगे, शॉर्ट हेड ऑफ बाइसेप्स लिख दोगे. ठीक, एक्सटेंशन ऑफ द शोल्डर जॉइंट में क्या क्या लिखोगे? इंफ्रास्पाइनेटस, टेरिस माइनर, ऑल्दो दीज आर वीक एक्सटेंसर्स. देन मेनली इट इज ट्राइसेप्स ब्रेकियाई, दैट इज द चीफ एक्सटेंसर एट द शोल्डर जॉइंट. देन एक मूवमेंट होता है कोरोनल प्लेन में जिसको कहते हैं अडक्शन अबडक्शन, और ये होता है एंटेरो पोस्टीरियर एक्सिस के अलोंग. इसमें अडक्टर्स के बारे में लिखोगे तो चीफ अडक्टर इज द स्टर्नल फाइबर्स ऑफ पेक्टोरालिस मेजर एज वेल एज सबस्कैपुलरिस, टेरिस मेजर, लैटिसिमस डॉर्साई. देन abductors at the shoulder joint are supraspinatus, the acromial or the lateral fibers of the deltoid, which are multipinnate. Then overhead abduction is by lower 5 digitations of the serratus anterior along with the trapezius. फिर एक movement होता है along the vertical axis, and that is called medial and lateral rotation. So medial rotators at the shoulder joint are subscapularis, sternal fibers of pectoralis major, latissimus dorsi, teres major. लेटरल रोटेटर्स क्या होते हैं? टेरिस माइनर, इंफ्रास्पाइनेटस. अब एक इन मूवमेंट्स के कॉम्बिनेशन वाला कंबाइंड मूवमेंट होता है दैट इज कॉल्ड सर्कमडक्शन. तो ये सर्कमडक्शन जो होता है इसका एक आर्क होता है, like when you're doing bowling in a cricket match. So the arc goes like this. Firstly, there is extension of the arm, then abduction of the arm, then flexion of the arm, and then adduction. So if you combine this movement in this order, it will form an arc. That's called circumduction. This movement is only possible at ball and socket joints. हो सके तो डायग्राम्स भी बना देना इस क्वेश्चन में. देन 2D इज अबाउट रिस्ट ड्रॉप. तो भाई रिस्ट ड्रॉप का मतलब है एक्सटेंसर्स ऑफ द रिस्ट पैरालाइज्ड हो जाते हैं. वो कब होंगे? जब कॉमन एक्सटेंसर ओरिजिन से अबव रेडियल नर्व की इंजरी हो जाए, राइट? क्योंकि रेडियल नर्व सप्लाइज द एक्सटेंसर ग्रुप ऑफ मसल्स इन द बैक ऑफ फोरआर्म. तो रेडियल नर्व का कोर्स तो पता ही होना चाहिए तुमको, ठीक है? तो रेडियल नर्व before it supplies the common extensors which are arising from the anterior surface of the lateral epicondyle of humerus, before to that in the lower half of the humerus space or in the radial groove, if radial nerve is injured, so it will cause paralysis of all those muscles in the back of forearm, causing extension at the wrist. ठीक है? तो उसमें वो सारे एक्सटेंसर्स ऑफ द रिस्ट भी चाहे तो लिख सकते हो. एक्सटेंसर कार्पाई रेडियलिस लॉन्गस, एक्सटेंसर कार्पाई रेडियलिस ब्रेविस, एक्सटेंसर कार्पाई अल्नारिस, एक्सटेंसर डिजिटोरम, एक्सटेंसर इंडिसिस, एक्सटेंसर डिजिटी मिनिमी, right? All these will be paralyzed, as well as extensors of the thumb will also be paralyzed. The extensor pollicis longus and extensor pollicis brevis and abductor pollicis longus will also be paralyzed. And don't forget, supinator muscle will also be paralyzed. But in case if they sometime might ask the reason behind the finger drop की अगर बात करते हैं instead of wrist drop, then it is because of the injury of deep branch of radial nerve in the back of forearm, which is also called PIN, posterior interosseous nerve of forearm. So it supplies the deep muscles in the back of forearm and it passes below to the extensor retinaculum through the fourth compartment. And there this PIN might also have a pseudoganglion. Remember, an orthosis called cock-up splint is required along with physiotherapy to overcome this weakness. Now moving to question number 3, multiple choice questions. Question number 3A is medial border of cubital fossa is formed by. This is a super easy question because cubital fossa नहीं आता तो फिर तो एग्जाम देना ही बेकार. So the choices here are pronator teres, brachialis, brachioradialis, biceps. I believe you all must be knowing that the medial border of the cubital fossa is formed by pronator teres. Answer is A. If you talk about the right forearm, so in the right forearm, this will be like this. Brachioradialis forms the lateral boundary, pronator teres forms the medial boundary, and the base of the triangle is formed by the transverse crease of the elbow. This is medial and this is lateral. 3B. Which of the following nerve supplies the deltoid muscle? Again an easy question. Options here are axillary, radial, medial or musculocutaneous nerve. So you must be knowing that the deltoid muscle is supplied by axillary nerve, which actually splits into its superficial and deep branches at its posterior border. The deeper branch runs under the cover of deltoid and supplies this muscle from its deeper surface, while the superficial branch runs on its posterior and the lateral surface circumferentially from posterior to lateral side, and it also gives a twig to another muscle that is called teres minor, and that branch to teres minor also has a pseudoganglion. And this nerve, axillary nerve, while it supplies the deltoid on its outer surface by its superficial branch, there this nerve also supplies the skin over to the lower half of the deltoid, and that is also called regimental area. And that cutaneous branch is called upper lateral cutaneous nerve of the arm, that is a branch from axillary nerve. Question number 3C. To which of the following variety of synovial joint does elbow joint belongs? Pivot, saddle, hinge, ellipsoidal. So remember that elbow joint actually is a compound joint which actually has three bones articulating: humerus, radius and ulna. So humeroradial is actually a joint between a discoid head of the radius and the hemispherical capitulum. So that actually is a variety of ball and socket joint. While the humeroulnar joint is a joint between the trochlea of the humerus, which actually is like a pulley, and between the trochlear notch of the ulna. So that actually is a hinge joint, because ulna has an olecranon process also which fits into the olecranon fossa in the extension of the elbow. But because the role of radiohumeral joint is more involved in supination and pronation, so there is another joint here that is called radioulnar joint. That radioulnar joint is actually a pivotal joint causing supination and pronation by the rotation of the head of the radius over to the radial notch of the ulna. So in short, let me conclude that elbow joint is basically between the radius and ulna, which is actually the weight bearing portion of this elbow joint. So it is actually a hinge joint. Answer is C. Then question number 3D. Porter's tip deformity occurs due to Erb's paralysis, Klumpke's paralysis, paralysis of median nerve, paralysis of lateral nerve. ये कौन सी नर्व होती है भाई? लेटरल नर्व. पता नहीं भाई, लेटरल कॉर्ड ऑफ ब्रेकियल प्लेक्सस कहना चाह रहे थे, क्या कहना चाह रहे थे. Anyways, you all must be knowing that Porter's tip deformity is also called policeman tip deformity, and it is due to injury of the upper trunk of brachial plexus, also called Erb's paralysis. Question number 3A. All of the following muscles take part in the formation of the musculotendinous cuff of the shoulder except. So you know the mnemonic SSIT, anterior to posterior, subscapularis, supraspinatus, infraspinatus, teres minor. All these four muscles together form the musculotendinous rotator cuff of the shoulder joint. And the options here are supraspinatus, infraspinatus, teres major, subscapularis. So instead of teres minor, they have mentioned is teres major. So the answer here is teres major. C choice. 3F. Action of palmar interossei. Adduction of fingers, abduction of fingers, flexion of thumb, extension at the metacarpophalangeal joints. It's a very easy question. You all must be knowing that palmar interossei is basically an adductor of the fingers. Palmar interossei bring all the digits nearer to the middle finger, and that's why middle finger is devoid of its own palmar interossei, means there is no attachment of palmar interossei to the third metacarpal or the phalanges of the third digit. While dorsal interossei are abductors of the fingers, flexion of the thumb is by flexor pollicis longus and brevis, and extension at metacarpophalangeal joint is by extensor digitorum, assisted by extensor indicis and extensor digiti minimi for their respective digits. Question number 3G. Pyramidal fibers arise from which of the following Brodmann area? Area number 3, 1 and 2. This area is actually the primary sensory area, post-central gyrus. So it actually receives the sensory fibers. Area number 4 is precentral gyrus, the primary motor area. So from here, the upper motor neurons descend down. These fibers are also called corticospinal or corticonuclear fibers. And these are also called pyramidal fibers because the tract they form is called pyramidal tract. 21-22 is supposed to be the area of Wernicke's or the higher auditory areas. Here also there is incoming fibers. Area number 34 is also called entorhinal area. Now this area is located on the medial temporal gyrus, and it is generally related with afferent fibers of the incoming information and is participating in the memory and the navigation process. The rest of the choices A, C, and D are the sensory areas, while pyramidal fibers are the efferent neurons. So they have to arise from the motor areas, and here the answer will be B, area number 4. Question number 3H. In CNS, the myelin sheath is formed by Schwann cells, oligodendrocytes, astrocytes, microglia. So remember, Schwann cells form the myelin sheath in peripheral nerves, while oligodendrocytes form the myelin sheath of the axons within the CNS. So the answer here is B, oligodendrocytes. Question number 3I. Lateral spinothalamic tract carries pain and temperature from the same side of the body, pain and temperature from the opposite side of the body, crude touch and pressure from the same side of the body, crude touch and pressure from the opposite side of the body. So the answer here will be pain and temperature from the opposite side of the body. Remember, this is very important. While crude touch and pressure are being taken from the opposite half the body by the dorsal column, fasciculus gracilis and cuneatus. Last question 3J. Substantia nigra is seen in midbrain, pons, medulla oblongata or the spinal cord. This is also an easy question. If you have read about the cross sections of the brainstem, then you must have seen that substantia nigra is seen in the tegmentum portion of the midbrain. Answer is A, and it's done.